Good day everyone, I am your student nurse Kristina Cassandra Cesar from Davao Doctors College, and today I am going to be demonstrating assessment of the eyes. So we all know that our eyes are an important organ for our sense of sight. That's why we need to take care of it and have at least annual eye exams. So let's proceed to the pre-introductory phase. So prior to the conduct of the assessment is to review the client's previous medical records if available. So this is done in order for us to know the previous medical history of the patient to provide focus for the physical assessment of the patient. Next is to determine the scope of the assessment needed and prepare the necessary equipments needed. This is done for us to be able to know the extent of our physical assessment, and also preparing all the necessary equipment saves time and energy and prevents us from going back and forth in case we miss some equipment. So this equipment includes the following. So this Snellen or e-chart, which will be read by the patient in testing for visual acuity. This opaque card, which will be used to cover one eye while observing the uncovered eye. We also need to use these gloves to prevent cross-contamination since we might be touching some part of the patient's face. We're also going to be needing this pen light, which will be used in testing for light perception. Then, these cotton buds, which will be used later in assessing the palpebral conjunctiva of our patient. And lastly, this pen and paper for documentation. Then I'm going to perform hand washing and don gloves if necessary. So this is done to prevent the spread of microorganisms. Okay, so now let's proceed to the introductory phase. So first is to greet the client politely and the client's companion if around. Then, introduce myself and verify the client's identity using the two identifiers, which is their name and birthday. Then I'm going to ask how the client would like to be called during the assessment, and also establish rapport with the client. So verifying the client's identity helps us to know if we have the correct client, and establishing rapport with the client makes them feel comfortable and less anxious. Okay, so good day ma'am. How are you today?
I am good.
Okay, that's good to hear po. So, by the way ma'am, I am Kristina Cassandra Cesar, your student nurse for today. Can I touch your hand and see your wristband po?
Yes.
Can you please state your complete name and your birthday for me, please?
YrLvl, June 15, 2003.
Okay, thank you. So, how would you like me to call you po?
You can call me Angel.
Okay, so Miss Angel, so what language would you prefer for us to use, for us to understand each other easily? Do you understand me in English or would you like me to speak Bisaya?
Bisaya.
Okay, so from now on, Miss Angel, mag-Bisaya na lang ta ma'am, okay? Para mas dali na to masabtan ang procedure, okay po? Okay, so now I'll explain the procedure to the client and how she can participate during the assessment. I will then provide the client opportunity to clarify, ask, or raise any concerns. So this is done to elicit cooperation from the client, and providing them the opportunity to ask helps us to know if there's more information that our client would like to know more about. Okay, so Angel, ang procedure na ato ang buhaton karon kay ginatawag na assessment of the eye or eye assessment. So kanina procedure by the name itself, kay i-check na tong imuhang mata kung maklaro ba ka sa layo, sa ngit-ngit o sa hayag, ug kung nabay mga angles na makita nimong or dili. So natin mga position ani ma'am na magtindog ka, na apoy maglingkod ka, tapos na ko ipabasa sa imo sa layo, ug naay suga na ipatanaw ipaduol na ko sa imo. Okay lang po ba na sa imo ma'am?
Okay lang.
Okay, very good. So, basta cooperate lang yun ta ma'am ha, ug sa pabuhat na ko sa imo ha, okay? Okay, so Angel, before ta mag-proceed, nako ba kay mga pangutana na gusto i-clarify?
Wala man.
Okay, thank you. Pero if na, feel free na mangutana sa ako, okay?
Sige.
Okay, so then, I am going to ensure my client's comfort, privacy, and confidentiality. Also, the assessment setting is assured to be safe, secured, and free from distractions. Then make sure to position the client to a comfortable sitting position. So this is done in order to provide comfort for the client during the assessment, and also to provide dignity and have an interesting relationship with them. Okay, so ma'am, Miss Angel, comfortable ba ka sa iyong position sa paglingkod ka doon?
Komportable man.
Okay, very good. So, as you can see ma'am, ang gisirado na nako ang kortina o ang puntahan para sa imong privacy and para walay laing makita sa imo during the assessment, okay? So, ayaw kabala ka ma'am kay secured ang tanang information of results na ako makuha karon. Pasabot, dili ni siya pwede i-share sa uban. Kita lang duha makabaluan ni pati pud ang doktor o mga nurses na nag-atiman sa imo, okay? Nasabtan ko ba?
Nasabtan man.
Okay, that's good. So now let's proceed in the working phase. So let's start in assessing the visual acuity. So the goal of the visual acuity test is to determine the visual clarity or sharpness of vision of a patient. So first, check for use of any visual aids prior to starting the test. This includes the glasses. So if the client is wearing graded glasses, make sure to let the client wear it during the test. But if the client is wearing reading glasses only, tell them to remove it since it can cause blurred vision. So ma'am, mag-ask lang ko if nagasuot ba ka og graded glasses or mga contact lenses. Okay, so now I'm going to let my client stand 20 feet or 6 meters from the Snellen or E-chart. Then cover the eye being tested and ask her to read each line until she cannot decipher the letters or their direction. Now I will take the 3 readings. So first, she's going to read the Snellen chart using the right eye, then left eye, and after that, I'll let her read it using both of her eyes. So this will allow me to compare the results of each eye and provide a more comprehensive assessment of visual acuity. Okay, so let's test for the visual acuity. Okay, so sige daw ma'am, palihog daw basaha ang nakasulat sa chart taman sa imong makaya lang without exerting too much effort. So palihog basa ng Snellen chart gamit ang imong right eye and cover ang imong left eye using aning opaque card. Sige.
E, F, E, P, O, Z, L, P, E, D, E, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T, F, D, P, L, E, C, E, O, F, D, D, L, G, F, E, D.
Okay, thank you. So sa pikas na ko daw ma'am, natin na sa pikas.
E, F, E, P, O, Z, L, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, P, Z, L, E, F, O, D, F, O, E, R, D, R, D, F, L, T, C, T, O, F.
Okay, so palihog ko basaan ang gamit imong both eyes na to.
E, F, E, T, O, Z, L, E, D, P, E, C, F, D, E, D, F, C, Z, D, F, E, L, O, P, Z, D, D, E, F, P, O, P, E, C, L, E, R, O, D, F, C, T, R, D, L, P, C, E, O.
Okay, thank you. Ma'am.
Salamat.
Then, after that, record the readings of each eye and both eyes. This includes the smallest line which the person is able to read 1/2 or more of the letters. Because recording the readings is important for proper diagnosis and treatment. Okay, so now I'm going to perform selected vision test, which includes the light perception, hand movements, then count their fingers if the client is unable to see even the top line, which is the letter E or the 20/20 of the Snellen type chart. So ma'am, ang nakibuhaton ng mga counting sa akong kamot, tingnan kung unsa na number akong ginapakita sa inyo, okay? So, kailangan ni?
4,
Kani?
2,
Kani?
1, 5.
Okay, very good. So, ganoon na nakibuhaton ng mga movements sa akong kamot. Tapos tingnan kung asa nagtudlong ang akong kamot, sa taas ba, sa baba, or sa kilid. Okay, so, kani?
Taas, gilid, sa baba, sa akua.
Okay, so, karon magpasiga ko og ganang suga duol sa imuha. Tingnan ko og ganang asa di mo dapat nakita ang suga. Okay, sa taas ba, sa baba, or sa left, or sa right. Kani, asa niyo mo nakita ang suga?
Sa baba, sa taas, sa right, sa gilid.
Okay, very good. Okay, so now let's proceed in testing for visual fields. So a visual field test measures how much you can see out of the corners of your eyes. Your visual field is how wide of an area your eye can see when you focus on a central point. So now I will face the patient directly at the distance of 60 to 90 centimeters or 2 to 3 feet. Then I will instruct the client to cover the right eye with the card and look directly at my nose. Okay, so ma'am, pwede ba ninyo tabunan imong right eye gamit aning opaque card tapos tanaw directly sa akong ilong. Okay, sa akong ilong lang ayaw matanaw sa light, okay? Okay, so now I will also cover or close my eyes directly opposite to the client's covered eye and look directly at the client's nose. And I will then hold the pen light with my fingers, extending my arm, and move the object into the visual field from various points in the periphery. Note that the object should be at equal distance from the client and me. Then I will ask the client to report when moving object is first spotted. So this test will assess the client's ability to follow a moving object while maintaining a fixed gaze on a target, which is my nose. Okay, so ma'am, ang ina ko asa nakita nimo nakita ang kaning pen light na akong gigunitan garon. Sa taas ba or sa baba, sa left or sa right, okay? Okay, so tanaw lang jud kani directly sa akong ilong mama, okay? Ayun nagtanaw sa kilid-kilid, okay? Okay, so I will cover my eyes using this card directly opposite to the client's covered eye also. Okay, so enough mama, asan yung gabitan kita? So, asan yung gabitan kita ang anang pen light?
Sa taas.
Okay, so kani,
Sa kilid. Ay sa ubos. Sa right.
kani.
Sa taas. Sa ubos.
Good. So now I will just repeat the steps for the other eye and reverse the process. So this will allow me to compare and contrast the results for each eye. So ma'am, bali na punta sa pika sa left eye na punta ang pagpuli, okay? So kani.
Sa taas. Sa taas. Sa ubos.
Kani.
Sa right.
Okay, very good. Okay, thank you. So now let's proceed in visual inspection of the eyes. So first, we have to visually inspect the eyes for alignment and symmetry. So this is to identify any visible abnormalities that may affect eye movement and coordination. Then I will inspect your eyebrows for hair distribution and alignment and skin quality and movement. Then I will ask you to raise and lower your eyebrows. Okay, so ma'am, pwede ba nang itaas yung hinay mo? Okay, so ibaba naman. Very good. Okay, so I will also inspect the eyelashes for evenness and distribution and direction of curve. So check na mo yung eyelash ma'am, okay? Okay, thank you. Now I will inspect the eyelids for surface characteristics, for example, skin quality and texture. Then position in relation to the cornea, ability to blink and frequency of blinking. Then inspect the lower eyelids while the client's eyes are closed. So ma'am, pwede ba nimo i-blink imong eyes kadali? Close them. Okay, thank you. Okay, so now I'll inspect the area over the lacrimal gland and lacrimal sac for swelling. So, ang lacrimal, ma'am, is dili na part sa imuhang mata ug asa mugawas ang luha na to, okay? So, ulitin na ko na siya, okay? Okay. Okay, so now I will ask the patient to look up and depress the lower lid of the patient using my thumbs to assess sclera and bulbar conjunctiva. Okay, so ma'am, palikutan mo sa taas. Okay, check na po ang imong eyeball na white na part sa imong mata, okay? Okay, thank you. Then I will invert the eyelid to assess palpebral conjunctiva using this cotton buds. Okay, so this is done to evaluate the texture, color, and presence of any discharge in the upper eyelid. Okay, so ma'am, pwede ba na ako gamitan ang imong kaning upper eyelids niyo para ma-assess na ang inner part sa imong eyelids ko? Okay, so, okay, so after that, I'll inspect carefully each iris and pupil of my client. Okay, so check natin yung iris and pupil. Okay, so ang imong iris man kay brown and imong pupil kay black, which is normal. Then I will inspect the cornea and lens for opacities or clarity and texture. I will then shine a pen light from the side toward the eye or shine a pen light at an oblique angle to the eye, and I will move the light slowly across the corneal surface. Okay, so ma'am, tanaw lang straight sa ako ha. Okay, tapos magpasiga ko aning suga, kaning pen light lang sa kilid sa imong mata para ma-assess na ko ang lens nimo o ang cornea or kanang border gani sa imong mata kung na may presence of cloudiness. Kaya if naa, nagapasabot na siya na kay cataract. Okay, so magpasiga na ko ha. Okay, so look my cloudiness, which is good. Okay, thank you. Now, I'm going to assess direct and consensual pupillary reaction to light. Okay, so first I will darken the room partially and ask the client to look into the distance. Then I will shine a light obliquely into each pupil in turn, using a pen light approaching from the side. And while doing that, I will look for direct and consensual reactions. Okay, so ma'am, palungo na to ang suga kadali ha. Okay, so sige, palong na to ang suga. Tapos karon kay magpasiga ko og magpasiga ko aning pen light sa imong mata, then straight lang jud tanaw sa ako, okay? Okay, so now let's proceed in assessing the accommodation. So now I will assess the each pupil's reaction to accommodation. So first, I will hold the pen light about 10 centimeters or 4 inches from the bridge of the client's nose. After that, I will ask the client to look first at the top object and then at the distant object or at the far wall behind this pen light. Then I will instruct the patient to alternate the gaze from the near to the far object. Then observe the pupil's response. Okay, so ma'am, na ako'y ibutang pen light kani sa imong atubangan mga estimated 4 inches away sa imuha. So una, tan-awon nimo ning taas sa pen light. So focus lang gyud ka diri And then after that, tan-aw ka dito sa likod at tanang sa wall na to. Okay, so let's start. Tan-aw diri ma'am. Okay, tan-aw sa wall. Tan-aw sa pen light. Tan-aw sa likod. Tan-aw sa pen light. Tan-aw sa likod. Okay, thank you. After that, I will ask the client to look at the near object and then move the pen light toward the client's nose. Okay, so ma'am, tanaw lang diri sa pen light ha, tapos ako aning iduol sa imong ilong, okay? So focus lang diri sa pen light. Okay, so now I will perform the Hirschberg test by assessing the ocular alignment arising from the extraocular muscles. Because by evaluating the extraocular muscles, we can determine if the eyes are properly aligned and working together. So from about 2 feet directly from the patient, I will shine a light into the patient's eyes and ask the patient to look at it. After that, I will inspect the reflections in the corneas. Then look for direct and consensual reactions. Because this can help us evaluate the function of the pupils and the cranial nerves responsible for pupil constriction. Okay, so ma'am, kanong magpasiga ko suga sa imong atubangan mga 2 feet away sa imong ha. Tapos tan-awon na to if masigahan ba ang both iris or pupil nimo equally, if pantay ba sila. Okay, so start. Siga ko. Tan-awon yung suga mo. Okay, so far pantay man ang reflection sa imong duha ka mata o pareha sila nasa tunga sa imong mata, okay? So now I will perform the cardinal fields of gaze test or the extraocular muscle test. So I will assess extraocular movements looking for normal conjugate movement of the eyes in each direction or any deviation from normal, nystagmus, lidlag, and convergence. So first, I am going to stand 2 to 3 feet in front of the patient. Then ask the patient to follow this pen light while making a wide H in the air. So this is for us to assess the range of eye movements and coordination. After that, I will look for any jerky movements or any something vibration of the eyes of for nystagmus on a lateral gaze and on upward gaze. Because this can help detect any abnormalities in the cranial nerves that control our eye movements, which can cause involuntary eye movements. Then, I will watch for a rim of sclera between the upper lid and iris as the eye move up and down. Okay, so let's start. Okay, so ma'am, tanawan ng pen light na akong gunitan kanon. Tapos, sundin ni siya gamit lang ang imong mata. Okay? So, focus lang dali sa pen light gamit ang imong mata. Ayaw ilihok ang imong liog and tanawan lang din siya gamit lang dyan ang mata. Okay? Okay po? Okay, so let's start. Focus sa pen light. Then, okay, very good. So let's proceed in testing for convergence. So I will ask the patient to look at my finger as I move it towards the bridge of the nose to check for their eye convergence. So it is important to determine if the eyes converge appropriately since it is necessary for binocular vision and depth perception. Okay, so ma'am, sundi lang niya akong finger ha. Tapos iduon ako ni siya sa imong ilong. Tapos tutukin lang dyan yung finger, okay? So focus lang sa finger. Tapos iduon ako sa imong. Okay, very good. So that's how you perform all the various types of eye assessment. Okay, so now let's proceed to the summary and closing phase. So after doing all those procedures, I will summarize all the information that I have obtained during the working phase and discuss the findings to the client. I will also discuss to the client the possible plans to resolve health concerns if present. So it is important to verify all the information that I have gathered are all factual and correct, and discussing the findings and possible plans will ensure that the client also knows her overall health status and potential treatment plan. Okay, so ma'am, i-summarize lang ako ang tanang procedure na akong gibuhat ka ganiha, okay? Okay, so sa imong visual activity katong first na itong gibuhat jud katong nagpabasa ko sa imong anang smelling chart, Imong right eye, mabasa nimo tanan, mabasa jud nimo tanan even the smallest letter hangtod sa number 11. Then imong left eye kay mabasa nimo lampas 20/20 sad hangtod lang sa number 9. And then ang imong left and right eye kay 20/20 pasabot ang makita nimo makita ka in 20 feet distance. So that's all normal. Okay, so sa imong visual field katong ikaduha na itong gibuhat katong gipa-focus gyud sa akong ilong. While ginalihok na ko ang pen light, ang makakita man kaso ang imong upper field kay 50 degrees and then imong downward field kay 70 degrees, then ang imong nasal field kay 50 degrees, which are all normal. Then sa visual inspection nako kay ang imong kilay kay ang hair distribution kay imong kilay kay even and normal, tapos symmetrical siya, pasabot ay sabay nimo ma-raise and malo ang imong eyebrow. Okay, then ang imong eyelash kay normal since it is slightly curled man siya and is able to blink normally within 15 to 20 times per minute. And then, ang imong lacrimal area, kanang sa may kawasanan, nga isa itong luha, kanang wala siya swelling, so, and dili siya sakit if pinduton. And then, ang imong conjunctiva kay transparent, then imong sclera kay white siya, then, ang imong palpebral kay ang upper lid, kay imong ma'am, kay pinkish siya, katong pag-anan na po gamit ang cotton buds, pinkish siya, and wala siya any discharge. And then, ang imong iris and imong pupil size kay equal, then, ang imong iris kay color brown, tas dili siya cloudy, so katabot wala kay cataract. Then sa ato ang direct or consensual pupillary reaction to light atong gipalong din atong sugat atong darken atong room. Migamay ang imong pupil pagpasigyan nako sa pen light. So it is normal. Tapos katong pagduol nako sa pen light gani, nisugat or ni-converge ang imong mata, which is also normal. And then sa atong accommodation katong nagtan-aw ka sa pen light, katong gipatan-aw ka sa pen light tapos gipatan-aw ka sa wall. Pagtan-aw nimo sa duol ni constrict siya ang imong mata, tapos pagtan-aw nimo sa layo kay ni dilate siya. Okay, sa duol ni constrict siya, tapos pag sa layo ni dilate na siya. So tapos sa katong accommodation, katong nagtan-aw ka sa pen light gani, katong ingon nga tan-aw sa pen light, tan-aw sa layo kay imong left nga eye kay good siya kay ni duol or gisundan jud niya ang pen light. And then imong right eye kay ni move siya pero gamay ra. So dili kayo siya wala kayo niya nasundan ang pen light. So and then katong giduol pud nako mo na siya katong giduol nako ang pen light sa imong ilong. Mo to katong wala kayo sunod ang imuhang left eye, ang right eye lang. And then sa Hirschberg test, katong nagpasiga ko ganit sa layo, kung nagpasiga ko pen light sa layo, ang equal ang distribution sa light sa imong duha ka mata. Okay, so kasabot na eye reflection sa light sa both nimo eyes, which is normal. Then katong cardinal field of gaze, itong naghimo ganit tag H, itong naghimo tag H, sabay manilihok ang both eyes nimo, nasundan nimo siya gamit both eyes, so wala ni ato diri ang isa nato dito, wala. So sabay siya. Then wala jerky movement or kanang vibrate gani ang imong kanang black sa imong mata, or kanang brown, wala siya vibrate, so it is normal. Then sa convergence katong gibalik na pud nato diba katong giana na ko gamit ako ang finger. So mao tong ingon nga ang left nimo kay good siya kay miduol or miduol siya duol dali inward sa imong lacrimal area. Then sa right nimo kay ni-move siya pero gamay kay wala kay nasundan ang ako ang finger. Wala kay siya ni duol gani. So pasabot ana wala kay coordination ang duha nimo ka mata. Then nag-cross eye siya pasabot ana kay nata ginatawag na kanang esotropia. So mao to siyang sign sa esotropia. So kasabot ang right eye nimo kay nag-move inward duol dali sa imong lacrimal area, while ang kanang left eye nimo kay nag-stay lang dito diri. So nag-cross eye siya. Okay, so mao lang tong gibang buhat nato kanina. So gibalik lang ako gingon tanan. Okay, so now ang suggestion ako sa imo ma'am kay if mag-laptop or mag-cellphone gani ka kay i-less lang nato ang imuhang time screen, okay? Tapos dili lang magpalabi yung tutok sa screen para dili kayo madaot or magka-problem ang atong mata. Tapos natagan nato time na ipahulay ang atong mata, okay? Then padayon lang gihapon ang ato ang check up sa mata, okay? Para ma-monitor nato siya. Okay, so mao lang to ma'am. Okay, so then I will assess the client's understanding of the plan and the need for further teaching. Then I will provide the client the opportunity to clarify, ask, or raise any concern. This is for me to know if my client still needs more additional information or support to manage her health. Okay, so ma'am, ask lang ako if nasabtan po ba tanan findings and possible plans na ipang-discuss na ako.
Nasabtan man.
Okay, so para ma-sure po na ako na nasabtan po ang possible plans or natong mga ipang-ingon ako ganyan. Pwede po ba nimo explain sa ako sa itong suggestions na ihatag na ako sa imo para kabalo ba jud ka sa buhatan ko?
So, ako nasabtan sa imong pag-ingon kay if mag-cellphone or laptop, i-less ang time sa screen and then dili lang magpalabi og tutok sa screen para dili kadaot or magka-problem sa akong mata ug tigaot time na ipahulay og ipiyong ang akong mata ug ipadayon ang annual checkup sa eyes.
Okay, very good. So, I guess na sabtan na dyan mo ang tanan, buhaton. So, before nato ni end ang assessment, ma'am, na pa ba kayo mga pangutanan na gusto i-clarify sa ako, about sa imong gipangingon, basin na pa kayo, sa akong gipangingon, basin na pa kayo wala nasabtan, pwede kayo nimo i-clarify sa ako karon po.
Wala man.
Okay, so very good. So, I guess that's all for. So, after that, I will just thank the client and end the interview politely. So, it is important since it provides patient-centered care and to make them feel appreciated for giving you their time and effort. Then, after that, I will just remove my gloves. Okay, I will just remove my gloves and perform hand hygiene to deter the spread of microorganisms. Okay, so now since I've already performed hand hygiene, so I'll just thank the client politely. So, katulang ma'am, thank you kayo sa pag-cooperate and appreciate yun na po ang inyong time and cooperation. Okay, so ayaw lang kalimti o padayon sa pagpa-check up sa atong mata, ma'am ha. Okay, para ma-monitor nato ang improvements sa imong mata. And ayaw kalimti itong mga suggestions na ipahatag nako. And timan ilang tutanan na kung ipangingon na ko na ipahuway ang imong mata after magamit og gadget, kay kabalo ko nga gamit, sige jud ta gamit og gadget o dili lang ta magsobra og tutok sa gadgets kay importante kayo to siya, okay? So, thank you kayo, Ma'am Angel, and have a good day.
Salamat sa
Thank you. Lastly, document findings in the client record using the printed or electronic forms, okay, or checklist supplemented by narrative notes when appropriate. So it is important to document all the relevant and pertinent information because if it is not documented, then it means not done. And it can be also used by healthcare professionals for the continuity of the care. Okay, so that's all for today. Thank you for watching.